Hello and welcome to NCTV episode 41 and the first of the bright and frosty new year 2021. Today is all about sleep apnea and what you can do to help it. So sleep apnea is when your breathing stops and starts when you're asleep. The most common type is called obstructive sleep apnea or OSA, and it's caused by your airways being narrowed while you sleep, and this has been linked to obesity, having a large neck, getting older, having family members with it, smoking and drinking, alcohol that is, having large tonsils and adenoids, and sleeping on your back also. To know if you have it, aside from your breathing stopping and starting in your sleep, other symptoms include making gasping, snorting or choking noises, waking up a lot, and loud snoring. If you're still unsure as to whether you get any of these symptoms, just ask someone who may be within earshot of you when you sleep, if they haven't already told you all about it, that is. If you don't have the delightful option of being nagged to about it by your partner, then another way you can find out can be to get referred to a sleep clinic by your GP, and they will test your breathing and heartbeat during your sleep. Some other signs that you may have it are that during the day you may also feel very tired, find it hard to concentrate, have mood swings, or a headache when you wake up. The problem with sleep apnea is that it can adversely affect your health by leading to high blood pressure, and it also increases the risk of having a stroke and the risk of having a serious accident caused by tiredness. You may also experience depression, and it can obviously put a strain on your relationship with your partner. So what can you do about it? If the symptoms are only mild, then treatment is not always necessary, but if tests prove that you do have sleep apnea, then the NHS can provide you with what's called a CPAP machine, which pumps air into a mask you wear over your nose and mouth while you sleep. Other less common treatments may be to wear a gum shield while you sleep, and that will help to open up your airways, or surgery to help your breathing by removing your tonsils, for example. However, if you'd rather avoid all that, or just do something in conjunction with it, then there are some great mouth and throat exercises backed by science to help stop snoring and improve mild to moderate cases of OSA. These mouth exercises are also called myofunctional therapy or oropharyngeal exercises, and these help to improve the tone of your muscles around your airways. Before we get stuck into them though, it's worth noting, as with any type of workout, it requires time and effort for these to take effect, but when done properly, there have been significant reports of less snoring and improved sleep as a result. Existing research suggests to do these for 10 minutes, 2 or 3 times a day, for 3 months to reap the benefits. Bear in mind though that these may be less effective if your snoring is related to alcohol or sedatives. So firstly, there are 4 tongue exercises, and these are also recommended by the Sleep Foundation. The first is tongue slide, where you place the tip of your tongue against the back of your top front teeth and slowly slide your tongue backwards and forwards, moving the tip along the roof of your mouth, and repeat 5 to 10 times. This strengthens your tongue and throat muscles. Secondly is tongue stretch. Stick out your tongue as far as you can, try to touch your chin with your tongue while looking up to the ceiling. Hold for 10 to 15 seconds and increase the duration gradually. Repeat 5 times, and this will help to improve your tongue strength. Third is tongue push up. Stick your tongue up against the roof of your mouth and press your entire tongue against it. Hold this position for 10 seconds, repeat 5 times, and this will improve your tongue and soft palate tone and strength. And the fourth is tongue push down. Put the tip of your tongue against your lower front teeth, and then push the back of your tongue flat against the floor of your mouth and hold this position for 10 seconds. Repeat 5 times, and this will improve your tongue and soft palate tone and strength. Next we move on to 2 face exercises. Firstly, cheek hook, where you use a hooked finger and pull lightly your cheek outwards, and then use your facial muscles to pull your cheek back inwards. And repeat this 10 times on each side, and this assists in the closure of the mouth while breathing. Secondly, tightly close your mouth by pursing your lips, then open your mouth, relaxing your jaw and lips. Repeat this 10 times, and this improves tone and strength of your jaw, facial and throat muscles. The next exercise is to practice breathing through your nose. With your mouth closed and your jaw relaxed, inhale through your nose, then take a finger or a knuckle and close off one of the nostrils. Breathe gently through the open nostril and do this, breathe out, I should say, gently through the nostril, and do this 10 times, alternating between the nostrils. You may notice that one of them tends to be more congested than the other, and you can choose to work on breathing through the congested nostril more if need be. And this exercise improves nasal breathing, which stabilises the airway during sleep. The next exercise is to pronounce your vowels. Saying different vowel sounds involves the muscles in your throat, so deliberately repeating these sounds can help tone those muscles. So repeat the vowel sounds A, E, I, O, U, and start by saying each normally, then adjust how much you stretch out the sound or how rapidly you say the vowel. Repeat the same sound 10 or 20 times in a row, and then change to a different sound. Also, you can combine the sounds and repeat those as well if you like. The final exercise is singing. This activates multiple muscles in the throat and mouth and involves pronouncing diverse sounds, including vowels. Preliminary research has found that focused singing training may cut down on snoring. When singing, try to focus on repeating and forcefully pronouncing individual sounds rather than just singing normal lyrics. So there you have it, and that's all for today. I'll see you next time for some more bite-sized bits to help your health flourish. Bye-bye for now.